Hello. In this presentation, we will be going over the Community Health Needs Assessment performed by Duke University Hospital. This presentation was put together by Diana Martinez Garcia, Helen Erfer, and Chris Antonio. Duke University Hospital was established in 1925 to serve the Carolinas. Today, this hospital system is one of the best in the country and a cornerstone in the region. It is located in Durham, North Carolina, where it serves as the main teaching hospital for the Duke University Health System, which is a network of physicians and hospitals serving Durham County and Wake County, North Carolina, and their surrounding areas. We will analyze this community health needs assessment using the 16 evaluation criteria developed to provide a framework for evaluating the quality of community health needs assessments and implementation strategy reports. This community needs health assessment does contain some of the items essential to increase the likelihood of improved health outcomes for Durham County, including partner and stakeholder involvement, a clear definition of their community, description of the process, evaluation of the plan, and accessibility of plan as outlined in this slide. One of the key issues that this community health needs assessment identifies and seems to be on track to address is the issue of affordable housing. The county has received funding to address this problem through Affordable Housing Loan Fund, Duke University's Office of Durham and Community Affairs, Habitat for Humanity, A.J. Fletcher Foundation, and Duke University. In fiscal year 21, the plan was to have the multi-unit affordable housing complex finished and occupied, which was achieved. In fiscal year 22, the work related to affordable housing will continue to be led by Duke University's Office of Durham and Community Affairs. In this part of our presentation, we will be exploring the key issues and related interventions as identified by the responses to the 2020 Community Health Assessment Survey. To learn what issues were most important to people living in Durham, the survey asked 3 questions. 1. What issues have the greatest effect on quality of life for you personally and your community in Durham County? 2. What are the most important health problems, that is, diseases or conditions, in Durham County? And 3. What could be done in Durham to support you and your community? Many themes emerged in the results of the county-wide sample. Those themes are racial and ethnic disparities that exist across nearly all health outcomes, structural racism and historical policies such as redlining, immigration laws, and segregation are causes of health disparities, the fact that issues are linked, for example, housing issues are also access to care and food insecurity issues, and top ways to better support communities such as transportation, crime reduction, physical activity, infrastructure, affordable housing access to care, education system improvements, and stronger communication and outreach to community could also address some issues that impact quality of life and top health concerns. Overall, however, the majority of residents feel safe where they live in Durham. From these results, the top Durham County health priorities to improve the quality of life for all of the county's residents remained the following: affordable housing, access to health care and insurance, poverty, mental health, obesity, diabetes, and food access. However, we will focus on the first 2 as they are primarily interconnected with the rest of the key issues. Affordable housing. In Durham, the fair market rent for a 2-bedroom unit increased over 16% between 2016 and 2020 from $937 per month to $1,088. 31% of Durham households, nearly 40,000, are defined as cost burden, which means that they are paying more than 30% of their monthly income for housing. The 2019 Community Health Assessment Survey samples demonstrated that 1. More than 7% of respondents that were sampled residents reported a history of eviction. 2, whites were more likely than blacks to own their homes. And 3, 40% of the county-wide and 12% of the Latino and Hispanic neighborhood sample respondents indicated housing-related issues were a priority to improve quality of life for people. The percentage of uninsured Durham residents decreased from 13.5% in 2015 to 10.8% in 2018. An estimated 40,573 Durham County residents were uninsured in 2019, which equates to 12.8%. Durham County residents in the 2019 Community Health Assessment Survey identified cost as the primary barrier to getting health insurance, followed by immigration status, lack of employer-based plans, and unemployment. The 16.1% of the population in the 2019 Community Health Assessment Survey who expressed difficulty acquiring care cited dental, primary care, and pharmaceuticals as the most difficult. This is the second key issue, access to health care and health insurance. Now below we have some affordable housing recommendations. Durham must focus on quality, safe, affordable, and housing for all. Opportunities include the funding from DAHLF, which offers $15 million towards the purchase of affordable housing. This is the time to use those dollars to think outside of the traditional models and move aggressively to purchase housing that is at risk of gentrification to secure it for the future of Durham residents. Durham led North Carolina with passage of the housing bond. It is important to ensure a well-represented community advisory board for housing bond implementation with ongoing transparency. Public funds are also available for housing services, but the funding pathways for city and county funds are frequently complex and burdensome, keeping smaller community agencies from participating in housing or homeless service grant opportunities. A community entity that could apply for, manage, and distribute funds to agencies that otherwise would not be able to participate would increase service providers and reduce burden on overstretched organizations. A short-term solution to the administrative burden problem would be that the city and county to increase the dollar amount that is available for discretionary spending. Increased community awareness for free and fair city inspections of rental housing that is perceived as unsafe or substandard is important. Substandard housing is heavily concentrated in Black communities, thus attention to inspection and remediation is an equity issue. The surge of interest in families impacted by the DHA McDougall Terrace carbon monoxide crisis is an opportunity moment. There are many other substandard DHA and non-affordable housing properties in Durham with concentrations of low-income families, disabled adults, and seniors. The community needs a private-public partnership to focus on specific properties in Durham. The Durham Public Schools Foundation is a possible model for this type of initiative. Access to health care and health insurance recommendations. Expand Medicaid in the state of North Carolina. Increase broadband for the use of telehealth and Wi-Fi in rural areas. Ensure the free transportation to medical services is available for those who need it. Encourage organizations and their staff to attend racial equity trainings. Continue to encourage support for and expansion of clinics providing care to the uninsured or underinsured on a sliding fee scale or for free. Promote awareness of Project Access of Durham County and Duke and local hospital charity care programs. Increase education to Durham County residents about the value of connection to a primary care medical home as a place where they can receive timely, comprehensive, and coordinated health care. Continue to disseminate useful health coverage information and advocate for basic access to care and expansion of coverage options. Improve access to Social Security disability benefits for individuals with physical, mental, or co-occurring medical conditions. Support the development, implementation, and expansion of the NC Care 360 platform. Advocate for safe and affordable housing. Plan for interventions. Duke University Hospital does not outline a clear plan for implementing interventions to solve these issues. It does, however, list the current initiatives and activities the county has going on to address these problems. The list mostly includes nonprofit and community organizations with some state and federally funded programming. Affordable housing initiatives and activities. There are various organizations and agencies working to improve the housing situation in Durham County. Alliance Health Mental Health is a health, substance abuse, and intellectually disabled LME that helps clients facing housing problems or homelessness with case management and opportunities for short-term housing support through the Independent Living Initiative, ILI. Leased housing through the DASH program, and moving from institutions to apartments with transitions to Community Living Initiative, TCLI. City of Durham manages multi-million HUD, which stands for Housing and Urban Development, contracts for housing and homeless services, conducts property inspections, and is overseeing housing bond implementations. DataWorks NC is a local nonprofit dedicated to democratizing data that maintains social driver and health data on the Durham Neighborhood Compass website. Durham Affordable Housing Loan Fund, public and private partnership providing financing to create a preserve multi or family affordable housing units in Durham. Durham CAN, which stands for Congregations, Associations, and Neighborhoods Broad and Diverse Membership Coalition, working to bring key issues to elected leaders to promote change, a leader in the movement to improve housing affordability and quality and proximity to transit. Durham COC, which is the HUD mandated community collaborative that sets policy around homeless services in Durham, including prioritization for housing and funding allocations. Durham COC, the HUD mandated community collaborative that sets policy around homeless services in Durham, including prioritization for housing and funding allocations. Eviction diversion programs collaboration between Duke Law School, Legal Aid, and the Department of Social Services with funding from the city and county. Housing for Hope, which is a nonprofit active in multiple areas, including the new in 2020 street outreach team, which serves homeless people living outside with case management and referrals. H&H also owns and maintains 3 permanent supportive housing sites and directs a rapid rehousing program. Partnership for Healthy Durham, which is a health and housing committee, newly developed committee in response to the 2017 CHNA that works to increase education and advocacy regarding health and housing. Project Access of Durham County oversees the Durham Homeless Care Transitions, or DHCT program, with the goal of assisting medically vulnerable homeless and people transitioning from institutions. Reinvestment Partners in 2020, in addition to ongoing efforts to increase affordable housing stock, RP developed the Hotel to Home program, refurbished rented hotel with county and alliance funding to provide a safe post-hospital location for individuals between mental health hospitalizations or homelessness while medically vulnerable to COVID. There are also various organizations and agencies working to improve access to health care for the residents of Durham County. Access to Care Committee, which is a subcommittee of the Partnership for a Healthy Durham, develops community and agency-based strategies to make measurable improvements in access to care for the uninsured and underinsured residents in Durham. NC Care 360 is the first statewide coordinated care network to better connect individuals to local services and resources. NC Care 360 is the first organization of its 60 is the first statewide network that unites healthcare and human service organizations with shared technology that enables a coordinated, community-oriented, person-centered approach for delivering care in North Carolina. NC Care 360 Durham Task Force meets monthly to address any issues or concerns with the platform. Project Access of Durham County links people without health insurance into a local network of clinics, labs, pharmacies, and hospitals that donate their efforts to those in need. This organization serves eligible low-income, uninsured Durham residents who have specialty medical care needs. HELP, or the Health Equipment Loan Program, is part of the Project Access for Durham County. HELP accepts gently used durable medical equipment, refurbishes it, sanitizes it, and makes minor repairs, and then loans it to Durham County residents in need. Durham Homeless Care Transitions, or DHCT, is an initiative led by Project Access of Durham County in partnership with LATCH, or the Lincoln Community Health Center's Healthcare for the Homeless Clinic, and the Duke Outpatient Clinic. Senior Farm Assist promotes healthier living for Durham seniors by helping them obtain and better manage needed medications and health education, Medicare insurance counseling, community referral, and advocacy. Lincoln Community Health Center, LCHC, provides accessible, affordable, high-quality outpatient health care services to the medically underserved at one central clinic and 9 satellite clinics. Durham County Department of Public Health provides clinic services for targeted public health issues, offers outreach and case management particularly to reduce risk in children, pregnant women, and people with specific communicable diseases, and provides community education to promote health. Alliance Health provides a 24-hour call line for people needing an immediate response to issues of mental health, developmental disability, or substance abuse. Callers get either information or a referral to an appropriate service provider. CARE, Inc. provides numerous services, including a free clinic focused on reducing HIV and sexually transmitted illnesses and preventing other significant health conditions. The Samaritan Health Center provides comprehensive medical care to the underserved members of our community, regardless of their ability to pay. Together with its partners, DUH asks about and listens to concerns, explores barriers to care, analyzes healthcare utilization and costs, identifies partner needs and resources, plans and redesigns services, tracks outcomes, and shares accountability in order to develop effective programs to improve the health of the Durham community. As such, this implementation plan includes a new and long-standing program. These plans are in place, and we should begin to see the shift in improving this health priority. The reports take 2 years to collect. The 5 health priorities for 2021 through 2023 remained the same as those of the previous assessment cycle. Affordable housing, as defined by HUD, requires no more than 30% of a family's monthly income. If a family spends more than 30% of income on housing, they are less able to pay for other expenses, such as food and health care. The increased cost burden of unaffordable housing adds to psychosocial stressors that can negatively impact a family. Renters make up 40% of households in Durham, and almost half of them are defined as cost burdened. DUH has partnered with Habitat for Humanity of Durham on a number of home builds. Additionally, affordable housing is a focus of DUH as part of the larger Duke University. In 2018, funding from Duke University and the A.J. Fletcher Foundation provided the opportunity to develop 2 acres of prime downtown Durham land into multi-unit affordable housing. The multi-unit affordable housing is expected to be completed and occupied by 2021. Access to healthcare in a community refers to the ability of residents to find a consistent medical provider for their primary care needs, to find a specialty provider when needed, and to be able to receive that care without encountering significant barriers. Although there are many medical providers, including many low-cost and free clinics in Durham County, there are still many Durham residents who have trouble accessing care when they need it. Barriers to obtaining health care include issues with transportation, language barriers, or distrust of the healthcare system. The top reasons identified by Durham County residents for why they or someone in their household could not access necessary health care included insurance not covering services, co-pays being too high, lack of insurance, or not being able to get an appointment, or also not knowing where to go for a provider. A number of long-standing programs supported by DUH seek to increase access to care for uninsured and underinsured and or vulnerable individuals and families, including Project Access of Durham County, Local Access to Coordinated Health Care, the Complex Child Program, Southern High School Wellness Center, Just for Us, neighborhood and community clinics. In conclusion, these programs are sufficient to meet this need. As these programs continue to expand, the outcomes will continue to improve. Critically evaluating this prevention shows a pattern of having the same 5 health priorities again and again. Thus, it would appear that DUH is working on a tertiary level and require the attention on a primary level. In summary, evidence-based approaches that we recommend. Evidence-based approach for affordable housing. The first intervention we propose is a tenant-based housing voucher program. The Community Preventive Service Task Force recommends tenant-based housing voucher programs to improve health and health-related outcomes for adults. These would help relieve stress, provide relocation opportunities, provide social resources. This will require an intervention to stop the people that are falling into financial hardships and give them the opportunity to thrive. Research supports a population approach. The second intervention we propose is hypertension screening to address lacking primary care. Consider SES factors such as age, education level, financial status to determine strategic placements for screening sites. In Durham, El Centro Hispano has already established several blood pressure health check sites. This is strategic placement of where the screening is held, like the outside of shopping centers or restaurants where underserved communities can participate. Following the screening, people are given a brochure about the importance of checking their blood pressure consistently and the negative impacts high blood pressure has on a person. Research suggests high-risk approach. These are the sources we used to put this presentation together. Thank you. We hope you have enjoyed our presentation.